Good afternoon, everyone. Good afternoon. I'd like to thank Commissioners Sims and Miller, Sauk Village Mayor Derek Burgess, as well as Cook County Superintendent of Transportation and Highways, Sis Killen, for joining me today. Cook County is home to an extensive transportation network. Roads, bridges, pedestrian and bicycle paths, as well as railroads, all play essential roles in transporting people and commodities safely and efficiently. It's the county's responsibility to ensure these important modes of transportation remain safe and in good condition. 5 years ago, we began a program that allows municipalities to advance much-needed transportation infrastructure improvements that not only enhance the quality of life for residents, but also allow for economic development opportunities. Today, we're excited to announce the recipients of the 5th round of Invest in Cook grants. Invest in Cook was introduced in 2017 as a way for the county to implement the priorities of Connecting Cook County, our long-range transportation plan that guides where and how transportation investments are made to attract and retain businesses, people, capital, and talent. Invest in Cook was the very first initiative of Connecting Cook County. Funding provided by this program helps our municipal partners cover the costs associated with projects that may have languished. No matter how big or small, these projects are fundamental for building back equitable communities and an overall stronger economy. This year, 67% of our grant funding is directed toward projects in low and moderate income areas. That's 2/3 of the funding. The Cook County Department of Transportation and Highways, under the leadership of Sis Killen, is awarding just over $8.5 million to help fund 34 projects throughout the county. Sis is the county's first female superintendent and has worked in transportation in our region for almost 10 years. Yes, applause. Thank you for the prompt, Commissioner. In the program's 5 years, we've awarded almost $40 million in grants for 162 projects across the county. Now is the time to invest in projects that are critical to improving our communities. The county's infrastructure must continue to be upgraded. This year, 4 transit, 15 bicycle, and pedestrian, 3 freight, and 12 road projects will receive funding. Sauk Village is a past and present recipient of Invest in Cook funding. The village was awarded $100,000 during this round of funding for improvements to a pedestrian and bicycle project along Torrance Avenue between Lincoln Highway and Sauk Trail. Superintendent Killen will speak more about some of the other recipients and projects receiving funding this year. Equal access to opportunity shouldn't depend on where you live. Every Cook County resident should be afforded safe, accessible, reliable, and affordable options for travel throughout Cook County. Making equitable investments has been and will continue to be a top priority for my administration. I'd like to congratulate the 2021 Invest in Cook recipients. Now, I'd like to bring to the podium Deborah Sims, who is Commissioner of the 5th District and Chairwoman of the Transportation Committee.
Thank you, Madam President. Again, let's give Sis another round of applause. I know all of us love John Yonan, because when President Preckwinkle became president, she brought John over from the city to the county to be our highway superintendent. The president's invested in Cook County and invest in Cook. Our projects that are done in the south suburbs, that if we had not had John and we had not had President Preckwinkle, some of the things that are now taking place would not be fixed. So to Sis, who now is the superintendent, is taking over from where John left off, we only hope that we have more projects throughout Cook County, not just I think we said 5 major projects that have taken place. You know, with the federal funding that's coming from the federal government, this gives us an opportunity to be able to take on more roads and bridges projects. I know in my communities, my mayors are constantly calling me saying, I got roads that need to be fixed. Got roads to do that. And we call Sis. And she's right on the money. If the funding is there to do it, she gets it done. So to President Preckwinkle and her staff, thank you for investing in Invest in Cook. So thank you so much.
Thank you. Commissioner Miller, I believe this project is in your district.
It is. Thank you, Madam President. And I want to thank you for inviting us all here today to talk about the Invest in Cook program. I represent the 6th district, where Sauk Village is my personal neighbor. They're right down the street from where I personally live as well. And we've always talked about the importance of investing in transportation infrastructure, which is especially critical in the south suburbs, and it has some of the longest commute times in the county. And the Invest in Cook program is consistent with the county's policy roadmap, which was instituted by President Preckwinkle's office, and is one of the key components of the roadmap is creating equity and including equity in transportation. And Invest in Cook is one of the programs that does just that. So infrastructure investment is a key when it comes to economic development and attracting businesses to the area, as well as ensuring development projects impact employees who live there. We're starting to see these investments are starting to bear fruit. Over the last year and a half, we've seen over $1 billion in private investments in the Southland, with thousands of jobs being created. And of course, we're always happy to see more with the influx of money coming from the ARPA funding. Invest in Cook has succeeded in creating collaborative projects between municipalities and transportation entities, resulting in stronger and more livable communities, benefiting both businesses and residents. And as we work to recover from the pandemic and rebuild stronger, these investments, we need to ensure that they succeed. So I'm grateful for the work that Cook County has done in supporting transportation and infrastructure in my district. And in this year, the 6th district had 7 award-winning projects that were awarded funds for multimodal transportation projects, including bus transit, freight, bicycle, and pedestrian engineering and feasibility studies, and roadway improvements. And I also want to congratulate Sis on the amazing work that she's been doing and will continue to do. We just had an issue last week where we had a road that I drive up and down all the time on Joe Orr Road, and Sis was right on it. She's like, we're on that. Not only is it a short-term focus, it's a long-term focus. So again, I want to thank Madam President for the opportunity to speak here, and Superintendent Killen and her team for the good work and partnership, and you do a great job at administrating the Invest in Cook program.
Thank you. All right, I'd ask Superintendent Killen to say a few words, and then we'll hear from the Mayor of Sauk Village, Derek Burgess.
Good afternoon.
Good afternoon.
Madam President, thank you for your vision and direction that helped shape the work that we've been able to accomplish in the Department of Transportation and Highways. I would like to thank Commissioner Sims and Miller for their support of our efforts to create a more equitable transportation infrastructure in Cook County, and Sauk Village Mayor Burgess for partnering with us today to prioritize the transportation needs for your community. This past year was challenging in many respects. I'm incredibly proud of my team who worked so diligently to ensure that this essential funding was made available for this 5th year. As Madam President stated, this year's Invest in Cook grants will fund 4 transit, 15 bicycle and pedestrian projects, 3 freight, and 12 road projects across 29 municipalities. These grants help municipalities further projects by covering the cost of planning, engineering, right-of-way acquisition, and construction associated with transportation improvements. But Invest in Cook is more than just funding. It's about building and strengthening relationships with our partners to make Cook County a better place for all residents. The county is a home to a diverse group of people, and the projects that we support continue to reflect that. I would like to highlight a few of our 2021 recipients today. We believe that a robust public transit system is essential to the county's vibrancy. One of this year's grantees is Metra. They will use their Invest in Cook funding award for the rehabilitation of the 147th Sibley Boulevard Station in Harvey along the Metra electric line. Our grant for construction this year allows follow-on from a previous grant for design engineering. The rehab station will be more comfortable for riders, along with new warming stations and a full canopy over the platform. This station plays a critical workforce role for Harvey, as 116,000 jobs can be reached just within a half-hour transit trip from this station. Several key bike trail connections are also being funded with this year's program. For example, in Niles, a new connection will be built to the North Branch Trail from the east along Toohey Avenue. North Branch Trail is one of the most heavily used off-street paths in the county. The project supports plans to redevelop the Toohey Triangle area, one of the most significant redevelopment opportunity areas in the village. This new connection will improve safety by eliminating the need for some on-street travel, but will also provide new pedestrian crossings as well. Vital local roadways are also being rehabilitated through the 2021 Invest in Cook program. For example, the Village of Maywood was awarded funding for design engineering for roadway improvements to 19th Avenue. This road takes residents to industrial jobs from across the village. The pavement is currently severely deteriorated and has major drainage problems that will be corrected through this project. Design engineering is the last piece of funding needed to secure the whole scope of necessary improvements to this route, which continues to show the important role that Invest in Cook plays in fulfilling gaps to help complete projects. Many projects that receive Invest in Cook funding simply help improve the quality of life and mobility in these areas. Sauk Village is a prime example. Here to discuss this year's Invest in Cook grant for that community is Derek Burgess, the mayor of Sauk Village. Mayor?
Okay, just want to say thank you, Madam President, Preckwinkle Commissioner, and also President Pro Tem, Ms. Sims, my Commissioner, Donna Miller, and Jennifer Siskillen, Superintendent of Transportation, for having me here today. Getting Sauk Village on a pathway to progress in partnership with Cook County has been a great journey. In 2017, when I was first elected mayor of Sauk Village, our strategic plan was our pathway to progress. And through our partnership with President Preckwinkle and Cook County, it has been a great and good journey working on this pathway. In 2018, Sauk Village was awarded $350,000 to allow for the engineering for the expansion of Sauk Village's logistics center, a 425-acre industrial park in Cook County. This work is vital to the future success and economic development opportunities in our community. This will allow for more jobs and better transportation connections. This has positioned Sauk Village to become more applicable for Phase 2 constructions, engineering, and construction with the U.S. Economic Development Agency to assist us with the build-out of roads and infrastructure as well. In 2020, Sauk Village received $300,000 from the Invest in Cook for our study to the link to the Old Plank Road Trail and Pensy Greenway. We recently approved our lead constituent for this project. This will link Sauk Village with other communities into Indiana. Today, Cook County Board approved Sauk Village's request to assist us with making much-needed sidewalk pedestrian investments at Sauk Trail and Torrance Avenue. The $100,000 grant will allow the village to begin Phase 1 work on making a proper connection for residents crossing two of the busiest streets in our community and making it safe to the Pace bus stop. We truly appreciate President Preckwinkle and our county commissioners' commitment to transportation and the Investment in Cook program. Sauk Village and the county residents can be proud of the hard work and dedication of the president and her staff. Thank you very much.
Thank you, Mayor Burgess, and we'll take questions.
All right, we're going to start with on-topic questions first. We'll start with the reporter in the line. Want to go, Alex?
I don't have any on-topic actually on this, so I'll leave it.
All right, we'll go to reporters on the line. WGN, are you on there?
We are here, but we have off-topic questions as well.
Okay. Any reporters with on-topic questions? Going once? Twice? All right, Alex, you want to go ahead?
Sure, Madam President, I'd like to ask you about the ARPA framework that passed today. If you could just talk a little about the significance of that, and particularly that first $25 million tranche, how that's going to get the process started.
Well, I'll ask Amar Ritzky to come up and say a few words, but let me just say, the county is going to get over the the course of this $1 billion, and we want to be very, very careful that we invest that money in ways that have maximum economic impact in the recovery of our county from the economic consequences of the pandemic. We wanted to begin by kind of putting guardrails around how we might spend the money. And so that framework is what passed today, along with a modest amount of money, $25 million, that Amar can talk about more specifically. But we're very grateful. I think the vote was unanimous. Very grateful to our commissioners for supporting the broad framework that we laid out. Amar Ritzky is our Chief Financial Officer and has been deeply involved in all of this. I'd like him to say a few words.
Good afternoon. Amar Ritzky, County's Chief Financial Officer. So, as Madam President stated, we began really this work last year as part of the CARES funding, where we wanted to make sure that not only county operations were supported, but also a lot of the public health impacts from the pandemic that were being felt out in the communities, both our suburban jurisdictions, local towns and villages, library districts, as well as all our businesses and residents. And so that work obviously now has doubled, tripled in many ways with the ARPA funding. And so we did a lot of that work on our own. It was second jobs for many of us, especially in the support areas. I know Mr. Rocha and will agree, a lot of his staff did the same thing. And so what we're now doing in terms of the framework is making sure that we are using the policy roadmap as a guide to help recover from this pandemic. The last year's efforts were relief, immediate relief. This is recovery. And our goal is to improve beyond what we entered the pandemic in. And in order for us to do that, there's some startup costs. So the startup cost is what the board authorized for us this morning, which was basically ensuring that we have some personnel and non-personnel contracts, administrative cost-related resources available for our supporting departments like the finance areas, our human resources, IT, procurement areas, along with some of the more key programmatic areas, the health system, our Justice Advisory Council, and our economic development teams, where they can have those resources ready to go. In coordination with that, there's a huge stakeholder engagement process that is also unfolding. And so our goal is to take that community input along with our not only just our residents, but our elected officials, village mayors, aldermen, ensure that all of that is put into place where those ideas that are coming through can then be vetted and put together for county board approval as part of the 2022 budget cycle. So in order for that work to happen next year, we need to put some initial investments in play. And so that's what that $25 million is for. So personnel costs, about $3 million is what we've sought the authority, up to $3 million for the end of this year. Then about $10 million in non-personnel costs. These are consulting, technical assistance, things like that we probably will hire external consultants for. And then the remaining $12 million was for the community recovery initiatives that we launched last year under the CARES framework. We want to make sure there's no break in services in those because some of those elements are still hurting our communities out there. So we want to make sure those programs are out there. And so by having that funding, there's not going to be any break of services when the CARES funding expires this year and the ARPA funding can take over. So that's really the crux of it, but this is the first one. There's a number of other ones that are going to be coming down over the next few months to allow us to continue to expand based on that framework that was laid out on the 24th of June. Thank you.
Yeah, Madam President, in light of the conversation today about support for survivors of domestic violence, I'm wondering what you, in particular, want to be seeing from Chief Judge Evans' office, from Clerk Martinez's office in response to some of the issues that we heard about today, and what role ARPA might have in building those supports.
Well, I can't speak to ARPA, but I can say that the Board of Commissioners requested a written response from the Chief Judge by next Friday in regards to the recommendations of our Women's Commission around domestic violence, a report on the status of hybrid courts, and then what was the team that was being put together to implement hybrid courts. So those are the three things that the Chief Judge was asked to respond to by next Friday, and we look forward to his response.
vaccinated individuals should be wearing masks in indoor settings? Do you plan to issue any updated mask mandates for the county? How worried are you about the spread of the Delta variant across the county as well?
Well, you're not in the room, but everyone is masked except when they're speaking. And we have a sign out in front of our building that says masks are required within the building. As to the spread of the Delta variant and the consequences of that, I would ask Israel Rocha, who's head of our health and hospital system, to speak to that issue.
Hi, good afternoon. You know, what I would say is that we have taken a lot of efforts to make sure that we have done our best to mitigate the spread of COVID and how it's progressed over the last few months, and we've done well. The introduction of the Delta variant is always something new that has been ongoing in this ever-changing process as we try to work with COVID. There are some things that we should know, and I will answer that, and that's what we should know. First and foremost, we do know that the vaccines are able to help and to continue to mitigate any factors related to even the Delta variant. And so what that means is that even as we're starting to see a spread of the Delta variant in greater parts across the country and here locally, on today's CDC variant, the real trigger to that was that we used to be under 50 cases per 100,000 new cases. We crossed over to 51.75 today. We were expecting it, as we used to have 40 cases a week ago and had about 200 this week, and so of overall cases. So we knew that it was increasing, and we were concerned. We have always been concerned. I think the whole country's concerned about what the Delta variant means and where we're going. But I think what we always say is the best defense is for you to have information. So the best information that we can give you is that the Delta variant is more communicable. It does spread easier, and it is something that we need to be cautious of and aware of. It tends, when in differing patterns from before, it increases the viral load that patients have, which has the chance to be able to transmit much easier, even if you are vaccinated and have no symptoms, and even if you don't ultimately become infected. There's concern that it could spread from one person to another. That's why when you're indoors in certain areas, and especially if you're immunocompromised or around children under the age of 12 who would not have the ability yet to get the vaccine, it's important to wear a mask. We also know from the research that has come out from the New England Journal of Medicine, as well as institutes and health departments around the country and from the CDC, that the vaccines work. They're able to help to mitigate the severity of the illness that you have, and they're help reduce the prevalence in the community. And so what we can do, as we're concerned, is to make sure that we have the availability of vaccine. Everyone listening, that you encourage to take a long thought if you have not been vaccinated yet, that you re-examine the information, that you look at the differences that this virus can have, especially in its Delta variant form, to you and your family, and that you take a moment to rethink the information about whether or not you would like to get vaccinated. And we hope that your decision will be to be vaccinated. We know that the likelihood of mortality is relatively low when you are vaccinated. We do know that of the mortalities we have had, including with the Delta variant, over 90% are those unvaccinated. And so we know that if you are vaccinated, your chance for the most severe impacts of this illness are mitigated. If not, if you are vaccinated, you are able to mitigate quite a bit of that severity. That's the information that people should know. I think that the concerns we've heard back from the community is that they feel that they have been forced to get this vaccine. So today, we're wanting to start with information. Please take a moment. Think about it. The data is there. It is clear. If you get vaccinated, your ability to move forward with the severity of the Delta variant is greatly reduced. Your ability, meaning that your risk of severe infection from the Delta variant will be relatively low. Severe illness will be low if you can get vaccinated. Your ability to spread it to others becomes reduced if you get vaccinated. So please make the choice, look at the data, get the information, and get vaccinated. That's what we can do. We will continue to work with the CDC and our health partners to mitigate any information that we get and take the appropriate steps. So you have seen that yesterday our public health department from Cook County sent out a release that that children in schools should be masked. We also said people who are immunocompromised should be masked. People who are around people who are immunocompromised should always make sure they take steps to be masked. And today's decision from the CDC says when you're in indoor environments, you should be masked as we are today. And we will continue to be responsive to those steps. Thank you.
We also have Dr. Ribbon on the line. You didn't add Dr.
Whoops. I did the wrong thing. I tried to make it louder because I couldn't hear it.
So that's very, very important.
Thank you.
Try to do whatever we can to keep that positivity rate as low as possible. So the idea is to obviously do everything that we can, which includes masking and physical distancing, and of course vaccination. And vaccination is the only way that we're really going to come on the other side of this, and to hope that this current surge will not become a big one.
Thank you, Dr. Rubin.
Anything else from WGN?
I have just one quick question. We've heard a lot from city officials this week on Lollapalooza, but as you know, a lot of suburban residents travel in and out of the city all weekend to come to the festival. What are your thoughts about holding Lollapalooza this weekend? How concerned are you about the festival causing a spike out in the suburbs after it's all done?
I'm not so concerned about it causing a spike in the suburbs. I think that the way it's being set up is that you have to be vaccinated or you have to show proof of having a negative coronavirus test over the prior 3 days. I would defer to the Chicago Department of Public Health about more explicit guidance and measures that they're putting in place. But the bottom line is that if you're immune compromised, if you have not been vaccinated, maybe even if you are, if you're going to Lollapalooza, is to wear a mask.